Hi guys, good afternoon everyone. We'll just wait for a few more people to join in and then we'll dive. I'd love to know, while we wait for people, how busy is Wednesday afternoon for you guys? We've done this is our second session that we're doing on a Wednesday afternoon. And it'll be nice while everyone joins in to just get a little bit of feedback. Is this a good time? Do you suggest there's any other time we should maybe schedule our next webinar? So yeah, while we wait for people, just drop in what do you think about the time of the webinar? Wednesdays, middle of the day, afternoons, how are they placed for you guys? Great, I think we've got a good turnout for the beginning. We're about 40 people now, so I think let's get started. So hi guys, good afternoon. I'm Sonika, co-founder and product director at Zonka Feedback, an AI-powered patient feedback and experience management platform. I'm really excited to welcome all of you to today's webinar. This is a topic that's both critical and transformative for the healthcare industry. So today we're going to speak about building effective patient and complaint mechanisms for the NABH compliance. Now, meeting the NABH standards, as you all know, is not just about fulfilling a mandate, right? It's also about ensuring that patient feedback is enhancing the quality of care and improve overall patient satisfaction. At Zonka Feedback, together with my team, we've worked very closely with a lot of healthcare organizations in India as well as globally to set up effective feedback mechanisms to capture patient feedback in real time, which have resulted in improving patient experiences as well as to meet compliances like the NABH or the HIPAA compliance as well. So today, together, we're going to dive into the nuances of gathering and monitoring feedback effectively and how you can turn compliance into an opportunity to build trust and create better patient experiences. So over the next 1 hour together, we're going to explore actionable strategies. We're going to talk about tools that you can use as well as the best practices to help you streamline feedback processes so that you can meet the NABH requirement with confidence. Great. So let's get started now. I hope everyone's able to see my screen as well. So let's jump right in. So today's agenda, what I've done essentially is divided into two sections. The first section is the introduction to NABH. So just to get an understanding of what is NABH, and then dive into the accreditation standards for the hospitals in the sixth edition, which talks about patients' rights and education. So where do they mention and how do they mention about feedback and complaint management? So we'll just go over those standards really quickly. And we'll also understand the NABH levels and scoring, right? The second section, once we know about the NABH and the requirements that it has for the accreditation, we're going to talk about how you can effectively implement the feedback mechanisms, what the best practices are, what is CAPA. CAPA is spoken about so much in the NABH as well. So what is it exactly, how you can set it up, what are the best practices for it. And then lastly, we're also going to talk about how you can use feedback as a tool for continuous improvement and then use it for compliance, which is what the agenda for the session today is. So let's get started, right? So what is NABH? NABH essentially is the National Accreditation Board for hospitals and healthcare providers in India. NABH sets very stringent quality and patient safety standards for the healthcare facilities in India. This accreditation standards which are there, they actually set the benchmark for healthcare quality in India. And why are they essential? So they're essential for two reasons. One, to improve the quality of care. And second, also to gain patient trust. Right? As a patient, if I'm going into an organization or healthcare organization, a clinic, which is NABH accredited, I am, I'm assured that there is a healthcare quality and standard that will be followed in that healthcare organization. So it's very important to gain patient trust as well. Now, the NABH released the sixth edition of the digital standards in September 2024 last year. And this has come into effect from January 1st, 2025. Now, the sixth edition that is there has 10 chapters and it has 100 standards and about 639 objective elements. And in this, in chapter 4, which is called the patient rights and education, they talk about feedback and CAPA. And that's what we are diving into today. So this emphasizes both on feedback mechanisms as well as complaint management systems for your patients. And according to the NABH and according to us, why this is important is because it, of course, helps you get better patient understanding and, lead to better patient satisfaction. It also makes your complaint management and resolution very, very efficient once you set up these standards or adhere to these standards. And it also helps you streamline any kind of audits that are there and make sure that you're complying with everything. Right. So, what are these standards? So, let's look at what these standards are. So in the NABH, in the Patient Rights in Education, in Standard 7, which is a part of Chapter 4, the requirement or the standard states that the organization has a mechanism to capture patients' feedback, experience, and to redress complaints. So let's break this down, right? One, they talk about capturing patient feedback. Second, they talk about capturing patient experience. And third, they talk about redressing complaints. And they expect that the organization has a mechanism to do that. So you're not just doing it on the fly or whenever you please. There is a mechanism, there is a strategy that you're doing this with. Right. And it's also important to have this exposed to patients and family members. So when a patient walks in or has availed any kind of, has any kind of interaction with the doctors, with the clinics, with healthcare facilities, them and their family members should be made aware of the procedure of basically giving feedback, lodging complaints. So it's something that needs to be out there that the patients have access to very, very readily. Right. And the organization makes sure that the complaints that are coming in or the feedback that's coming in is also addressed and redressed effectively. And that these standards, once they're set up, are also reviewed and analyzed within a given time frame. Right. So that's what the standard 7 talks about. And this is the main standard that focuses on the patient feedback. The next is in the same chapter, Standard 8. Now, Standard 8 is slightly broader. It does talk about feedback, but what it essentially says is the organization has a system for effective communication with patients and family. So it's not highlighting patient experience and satisfaction directly, but it talks about how your communication as a healthcare organization should be very, very effective with the patients and the family, right? So whatever complaints there are, whatever feedback that comes in, there is a easy flow of communication that happens with patients and family. Right. Now you'll see in both of these, I'll just scroll back. In both of these, the objective elements which are mentioned from A, B, C, D, E, some of them say commitment, some say achievement, some say core, right? And here also in Standard 8, the same thing is there. 4 of them are commitment and 1 of them is achievement. So what are these levels? So very, very quickly, I just want you to understand these levels as well. As an organization, some people who are working at the NABH accreditation or have worked on it may already know about it. But as implementers of the feedback system, or somebody who's going to be using feedback tools or collecting patient feedback, it's also good for you to understand what these NABH levels are and how does the scoring work. So there are essentially 4 levels which are there. One is the core objective. So this core objective is a mandatory requirement. So if you want the NABH accreditation, the core objective needs to be met 100%. So it's absolutely essential. The other 3 levels which are there, which is commitment, achievement, and excellence, have a scoring of about 0 to 10. So you basically can partially comply to these, but a little bit of compliance to these is also very, very important. So commitment essentially is a basic standard which is required for accreditation. Achievement shows that you are looking and demonstrating progress beyond the basics that are required. And then there is excellence, which is an aspirational element. So it shows that as a healthcare organization, you are focused on innovation and leadership. So, for the sake of ease, what I've also done is mention these relevant sections. So when you are looking at the slide or when you're looking at this presentation later, when we share it, you also know which of the relevant sections are under core objectives, commitments, achievement, and excellence. Great. So that's all about the NABH. What the NABH essentially requires from you as a healthcare organization to get accredited if you're talking about feedback and complaint management. Right. So let's now move on to the section two, which is actually the actionable and the exciting part, and what we're all here for. So in the section two, we're going to talk about how we can implement effective feedback collection mechanisms and CAPA mechanisms that actually work. They're easy, they're actionable for your team, and something that we really, really want you to help. You really want to help you with. Now, before we dive in, I want to run a quick poll and ask you guys that are you currently using any kind of feedback mechanisms? These could be manual feedback mechanisms, or these could be, something that you have like a system that's set up. So what is it that you're currently doing with regards to patient feedback right now? Are you using something or not using something? So I think you can see the poll on your screen. I'd love for you to just click on whether you're using feedback mechanisms or not and let us know. I see some of you mentioning it in the chat. I hope you've answered the poll as well. We have a few more seconds left for the poll. So if you haven't answered yet, just do, and then we look at the results shortly. Hey Vishal, nice to see you saying yes. So we've recently started working together with you. So I'm glad that that's a yes. Great. So we've got a great audience. We've got 81% here that say that yes, you are using a feedback mechanism, and about 19% that are not. If you're already using a feedback mechanism, I hope this is helpful for you to enhance that further. And if you're not using one, then great. That's everything that we're going to cover today. So thank you so much. Let's get on with our next slide. So here we're going to talk about implementing the feedback mechanisms, right? Now, a lot of times within your organization, you must have had this discussion maybe with the management, with your peers, etc. Of we need to take patient feedback, right? Everybody says that, everybody talks about it. But what are the practical ways that you can set it up? So what we've done today for today's webinar is that divided into two very, very easy things. One, to identify objectives. So what is the objective? And then secondly, to have action items, right? What is it that you can do to set it up? So there are four major objectives that you can start with when you're setting out your feedback mechanisms. The first objective is including all patient touch points. When you are starting out with your feedback journey, or if you already have it, don't pick and choose a particular touch point, right? Don't say, okay, this is easy, I'll start taking feedback here, and so on. Identify all possible touch points that are there. Whether you set them up on day one or you set them up over a period of weeks or months together, but make sure you've identified all of them. Anywhere where your patient would want to maybe, give a feedback or make a complaint, make sure those are all identified. So your touch points could look like pre-admission or when they make an appointment. It could be during admission. It could be during treatment, after their appointment, after their discharge or post-care. So identify these touch points, and in your worksheet, just plan how you want to automate surveys for these critical touch points, right? It's not possible. You may start out doing this all physically and manually, but when you don't automate these systems or have a process or plan, they are likely to fail eventually, right? Because the enthusiasm dies down. There are other things and other KPIs that the team needs to look at. So one, of course, is to include all patient touch points. The second is to set up multi-channel systems. Now, one channel does not work for all touch points, right? For example, in pre-admission or when somebody makes an appointment, they're not physically there at the clinic or at the hospital. So you can send them a SMS or a WhatsApp or an email. So basically, for all different touch points that you've identified, make sure now you've identified all the channels that you can possibly use. Another tip that I want to give you when you're identifying channels is to look at the type of patients you have. For example, we work with organizations where they've said, the Wi-Fi connectivity is not good. So then they've started using tablets in the hospitals, right? They feel like, their patients are very, very familiar with WhatsApp. So WhatsApp would be something that they want to use, not email so much. So know your patients, identify your channels, and in the next step, map them correctly to the relevant touch point. So you've got your touch points, you've got your channels, and then map them correctly of which touch point would be ideal, channel would be ideal for which particular touch point. Now, this is done. Then the third step is to design effective surveys. When you're sending a survey or a feedback form to your patient, it's a great time to ask relevant questions, right? We don't want to ask questions which may not have any relevance or may lead to fatigue, or the patient might feel, why are you asking me these questions? You already know so much that, which is the doctor I visited, the location I visited, what are the problems I have, and so on. So ask questions that really matter, because this time is critical. There's only as much time you have to communicate with your patient. So make sure you're asking the right metrics, whether it's patient satisfaction, patient loyalty, and so on, any suggestions you want. So make sure that your surveys are designed effectively. Another good way to do that is to use logic and personalization really, really well. So if I go into a clinic and I've had an appointment with a doctor, and the next day I receive an SMS or a WhatsApp or an email saying, how was your appointment with Dr. Agarwal? I'm likely to feel that this is more personalized to what my use case is. So make sure that you're also personalizing your survey. You're using display and skip logic very, very relevantly, so that your patients are able to see relevant questions and answer them. The chances of them answering those questions becomes, really high. And the last is to ensure inclusivity in the surveys. So as we saw in the requirements, that NABH has, inclusivity and easy communication is very, very important. So how do you make sure that this also translates in your feedback forms? You do this in two easy ways. One, make sure your feedback forms are multilingual. So you will have patients that speak multiple languages. These could be global languages, Indian regional languages. So make sure your surveys are in multiple languages so that there's no barrier. The patient does feel that this is personalized for you. And the second is to make sure your feedback forms are also mobile friendly. A lot of forms that you send through SMS, email, WhatsApp will be opened on mobile devices. So make sure that they're also very, very mobile friendly. Everything looks good. The questions are clearly visible. Everything is fitting in the screen. So make sure that that's something that you're testing as well. Now, before we talk about best practices of setting this up, there's another poll for you, where I just want to get a head count of which feedback collection methods are you using. Are you currently on manual or paper-based feedback? Have you shifted to something digital? Are you doing a mix of both? Or you're right now exploring certain options? And if you're exploring certain options, you're at the right place. So yeah, there's a poll that you will see on your screen. 30 seconds, just give me which particular channels are you currently using? Just a few more seconds left for the poll, and then we'll dive into some best practices. So just look at the poll on your screen and answer, and let us know what are the channels that you currently have set up. Great, let's see the results. Okay. This is interesting. So about 12% are using manual forms and paper feedback, which is great. I feel like if you're taking feedback, even if it's manually, it's fantastic. 18% are doing digital feedback. 59% are doing a combination of both. That's fantastic. I think that also makes sense. I'm hoping that this is a transitional phase for you, and that you will move to more digital methods. And there are about 12% people who are not taking any options, and you're exploring, or not taking feedback and exploring options. Great. So I hope the best practices that we discuss in the next step do help you out further. So I'm going to jump to the next slide. So here I want to talk about best practices for feedback mechanism. So we've looked at the objectives and what are the actions you can take. Now, what are the best practices that you should follow? The first and the most important one is integrating this with your HIMS system or your CRMs, etc. Right? This integration, why this helps is twofold. One, so that you can trigger surveys at various activities. So whether it's post-appointment or post-discharge, or at other touch points, if you want to take relationship feedback, etc. You can, if it's connected to your HIMS system, trigger these very, very easily, and you don't have to do that manually. The second is to sync your feedback data back into your HIMS. So in your HIMS, you have a lot of information, and the patient experience and satisfaction information could also be very easily brought in, so that people who only have access to your HIMS systems and are looking at it day in and day out also know what patient satisfaction looks like. The second best practice is to train and onboard your teams and give them visibility of incoming feedback. A lot of times, feedback, not just in healthcare, but other industries as well, fails because the teams are not onboarded. The staff is not told about why are we taking feedback. Just somebody decides, oh, we're going to start taking feedback, and then all these processes are put into place. And that's why down the line, it starts failing because the team is not committed to it. So it's very important to train and onboard your team. You need to educate people about the feedback mechanisms and the processes in place, conduct small workshops, and provide them tool specific training. So if there's a tool that you're using, let them know, this is how you can check patient satisfaction. If there are dashboards that you can give them access to, make sure those are also available so that progress can be tracked. There's accountability as well, and also automate reports. So a lot of times what happens is even key stakeholders can't like log into systems and keep checking excels, etc. So make sure these reports, etc., are delivered to their inbox so that they do have visibility. So yes, integrating with your feedback systems and then training and onboarding your teams. And the last one, which is my favorite, is using AI wherever possible. We do this heavily in our now as well. AI is not an enemy, right? We have to use it as extensively as possible to make sure a lot of our tasks become easy. So, when you're setting up your feedback mechanisms, what are the two ways that you can use AI? Is one, to create intelligent surveys, let AI know what your goals are, and it does bring out beautiful surveys that actually are very, very relevant. And you can also use AI to translate your surveys into multiple languages. Of course, once your feedback starts coming in, AI has more use cases as well. But when you're setting it up, these are the two interesting ways that you can use it. Great. So we've set up our feedback mechanism. So what's next? Next, I want to show you how Zonka feedback can help in this. So with a tool like Zonka feedback, any other feedback tool as well, that you may be using, what it does is it gives you different channels. So if you are right now looking for a feedback tool, make sure that you look for something that does have multiple channels for you to take feedback. You don't want to have multiple tools that are doing different feedback, etc. We work with a lot of organizations where they say, oh, our SMS is set somewhere else, our WhatsApp is set somewhere else, email is somewhere else, and there's so much management to do. It may have been easy when you were setting up initially, but now if you calculate the time and the ROI, it will be a lot. So bring everything on one tool, right? Which makes it easy for you to manage, your feedback effectively. The other thing that tools like Zonka Feedback help you do is also create multilingual surveys. So you can ask any kind of questions you want, but also make sure that they're multilingual. Great. So next, we're going to talk about CAPA. CAPA is something that goes beyond healthcare, of course. CAPA stands for corrective action and preventive action. It's a systematic process to identify the issues that are happening and to address the problems and also to prevent them from happening again, right? So corrective action is that there's a problem that's come and we have to investigate it and take action on it. But it goes beyond and it also talks about preventive action. So once we know that there's a certain issue that's happened and we've resolved it, it also needs to set standards for how to prevent it in the future. So the CAPA process involves 5 steps, and these steps could absolutely be different for you as an organization based on what your patients expect and how you want to set up the team. But 5 simple processes that are there. One is to identify the problem or the issue that's at hand. The second is to investigate the root causes. So what caused that issue to happen? The third is to develop and implement corrective and preventive actions. So corrective actions would be, how you can resolve it right away as effectively as possible. And preventive actions would be what is it that you can change? And that change could be not immediate, it could take weeks or months, but what are the preventive actions you're taking so that it doesn't happen again? The fourth step is to make sure you're also monitoring the effectiveness of the actions taken. And the fifth is to continuously review it so that there is a continued improvement that's there. So that's what CAPA does for us. And it's very, very important when you're taking feedback to also do your CAPA. We also call this we also refer to this sometimes as closing the feedback loop. And that's something that at Zonka Feedback also we focus very, very heavily on. So how do you set up your CAPA systems? Again, let's look at this from an objective and action standpoint. So for your CAPA, the first objective is to look at every feedback that's coming in, no matter the source of it. You need to make sure that there is a place where you get visibility of every feedback that's come in. This could also be verbal feedback. This could be feedback that you're getting through tools, online feedback. Make sure it's all coming together in one place and your team has visibility of it. The second is to segment this feedback and prioritize feedback that needs attention. So, feedback sometimes it's a lot of noise as well. So, you want to make sure that you also have a mechanism in place to identify which feedbacks are important and need attention because obviously they need to be resolved, right? So, assign severity, urgency, sentiment, and emotion to the feedback that's coming in and find a way to flag feedbacks that need attention, right? It could be in any way. It could be based on how urgent the feedback is or how pissed off the patient is, right? It doesn't always have to be. It could be a small issue, but if the patient is very, very angry, very, very miffed, it does become urgent. So make sure you're segmenting and prioritizing the feedback that needs attention. The next is to set up a resolution and escalation metric. A lot of times what happens is feedback comes in and then we're like discussing with the team, oh, what do we do? How do we resolve this, etc. Who should it go to, etc. So when you're setting up your CAPA system and when you're setting up your feedback system, have that already in place. What goes to which particular team members, what kind of tasks need to be there, which feedback gets routed to the right team members, because then only you can have a faster resolution and action. To give you an example, if there's an issue with appointments, it'll go to a completely different team versus some issue that's with the billing, or maybe somebody has received a wrong report or not received the report on time. They're all going to be very different departments and very different team members. If you map that already and route it to the right team members, the resolution will be faster, discussions will be lesser. So make sure that that's something that you set up as well, and also set up an escalation metrics. What happens if a task is not completed? Who should look at it? A lot of times these tasks will not be completed. It will have to be addressed by someone else, so have that escalation metric set up as well. The next and a very, very important aspect of CAPA is to communicate with patients. This is something that always gets missed out when we're setting up feedback systems because we feel like feedback is something internal. We've got it, we've resolved it, and that's how we're working on it. Communication with patients is very important when you're setting up your feedback and CAPA mechanisms. Now, there are two folds of communication. One, as soon as you receive a feedback, you need to respond promptly to the complaints that have come in, even good feedback. So, as soon as you get the feedback, you want to tell your patient, you want to tell your customer, hey, we've received your feedback, we acknowledge it, we're sorry about any issues you're having, etc. And then internally, when you've resolved that issue, you also want to communicate the action taken. If I've taken out my time as a patient and given you feedback that this is what went wrong, I of course want you to acknowledge that you will look at my issue. But if you've made any significant changes or even small changes or planned some changes, you also want to communicate that to your patients right away so they know that you actually looked at the issue. That's where you're transforming patient satisfaction. I was angry, I complained, you looked at the issue, you resolved it. When you let me know, it's going to obviously make me a happier patient. It's going to make me more loyal to the brand. I'm more likely to come back if I have any issues. I'm also more likely to recommend you to other friends and family. So communication with patients is very key. Once you have everything else set up, make sure that that's something that you're doing as well. And lastly, with respect to CAPA, as well as for your compliance, it's important to document the corrective and preventive measures that are happening. So, record the corrective actions which were taken. If there was an issue, a resolution was done, document that, write a note next to the feedback that this is what was done, and also look at what is the action that was taken for further feedback and further strategies. So, make sure you're documenting as well. So, 5 simple steps: look at every feedback, segment them really, really well, prioritize them. Third is to set up a resolution escalation metric. So, bring in your team, look at where your feedback is routed. Fourth, communicate with your patients. Super important. One of the most important things, I believe. And fifth is obviously to document the CAPA measures that you've taken. Great. So now we come to another poll where I want to get an understanding of how are you currently prioritizing patient complaints. Are you not prioritizing them at the moment, which is absolutely fine as well? This is why we're here. Or are you prioritizing them based on the severity of the issue, based on some scores you may be measuring, or are you treating all your complaints equally? So you'll see a poll on your screen right now, and I'd love to know how you're currently looking at and prioritizing the complaints that are coming in. The prioritization is something that I think at Zonka Feedback, we're also starting to do now. To now, what we were doing is any issues that came in, any requests that came in, we used to usually treat them absolutely equally. But with the use of AI, with the use of, getting an understanding of urgency and sentiment and emotion, using AI, we've been able to set up our priority of feedback as well. So yeah, it's absolutely fine if all complaints are treated equally. As long as the complaints are not ignored, all the other options are really good. Just a few more seconds, if you could just click on and answer the poll. Great, let's see the results of the poll. Okay. So this is absolutely fantastic. There are about 59% people that said that you're prioritizing the complaints that are coming in based on severity of the issue, which is, I think, exactly how it should be. 12% based on the NPS or the CSAT scores. 18% are treating all complaints equally, which would make patients really happy. And 12% don't have a process yet. So I hope this helps you get a better idea of how you can set up the process. Great. So I'm moving on to discussing best practices for CAPA, how you can set it up. So we discussed some best practices for feedback management setup. Now, these are specifically for CAPA. Right, the first one being linking your feedback to the CAPA tasks using responses in AI. So this is exactly what I was talking about that we've also started doing in Zonka feedback, where we automatically now create tasks for incoming issues based on conditions. So we spoke about this when we were speaking about CAPA, right? That if it's about billing, appointment, doctor, waiting time, caregiver, it is all different departments. It's all different tasks. You already know that. So make sure that when there's negative feedback, it's actually going to the right team members based on certain conditions. Second, very important, leverage AI to prioritize the complaints. So AI is fantastic for open-ended feedback. Of course, if you're not taking open-ended feedback, AI can't help much. But if you're taking any kind of open-ended feedback, which I hope you are and I hope you do, it will help you prioritize based on the urgency, complexity, how angry it is, how angry the patient is, and which basically complaints need some kind of resolution immediately. And you can use workflows to route the issues to the right team. The next is to escalate unresolved tasks. Again, we spoke about this in the CAPA setup, that you need to have an escalation metric and make sure that it's automatic so that anything that's overdue and unresolved goes to the higher management or the concerned party so that they can resolve that issue. The fourth is to track the resolution timelines. So it's important, that an issue comes in and of course, you will eventually resolve it, but it needs to also be resolved in the right timeline. Because if you're not resolving it right away or within a stipulated timeline, the patient will continue being, pissed off and miffed. So you need to make sure that you're preventing delays by monitoring this task completion very well. And the last is to generate performance reports. So you look at these reports, look at the outcomes. This is important from a compliance perspective. It's also important so that it's all working very, very smoothly and you're regularly being able to look at the CAPA processes. So I want to show you how at Zonka Feedback we've nailed this. So as soon as there's a feedback that comes in, you are able to have predefined triggers that you can set up that if your responses match these conditions, you can have automated tasks that get set up and get assigned to one of your team members or multiple team members. And you can also have an automated message that goes to your patient right away. So what's happening is as soon as the patient gives feedback, it'll match one of the triggers, either the angry or the happy or the neutral, and these are the conditions that match. Then whatever needs to happen, action that needs to happen internally, and the communication with your team members, that gets taken care of right away without you lifting a finger. Everything is just taken care of right away. So the next step now is, of course, to do the actual action, an actual thing that will make an impact there, right? What we also do at Zonka Feedback is help you create tickets and tasks internally. So there are two types of tickets that you can create. One would be internal tickets, so internal tickets that internal team members have to take care of, and the other would be patient tickets. So the patient does not have to raise a separate ticket. Based on that feedback, a ticket can get created automatically. The priority can be assigned automatically, and then that is something that they can also track easily. You can also email your patients directly from the system, whether it's based on the resolution, or you want to also sometimes investigate further on the issue. And patients don't always be available on phone calls. You can also email them right away and view their responses in the system. So everything that's happening is also available to you right away. So you can respond, you can escalate, and resolve your complaints very, very seamlessly. Um, Great. So now let's talk about feedback for continuous improvement, right? How do we leverage the feedback that's coming in for ongoing excellence? So again, like we've done for the rest of the presentation, we're going to look at 5 objectives and then the action steps that are there. So objective 1 is to identify feedback trends, right? We want to look for a continuous improvement, look at what the trends are. You want to look at how your scores are changing over a period of time. Are urgent issues dropping? How the sentiment is there. So you want to look at feedback trends and regularly analyze, recurring scores, recurring issues, recurring patterns, etc. The next is to analyze qualitative feedback. A lot of feedback that we get in healthcare is open-ended. When we analyze, healthcare gets one of the maximum in terms of like the length of comments. They're huge, and either patients are very angry about something or very happy about something. They tend to write a lot. So focusing on your open-ended responses is very important because it helps you uncover deeper insights that are there. Also, this is the part where you can use AI very effectively for sentiment, for themes, for understanding what is it that the patients are talking about, and get that well on your dashboard. The next is to act on urgent feedback. I know I've spoken about this multiple times, but it is very, very important. So when you start analyzing your feedback, looking at your feedback, and if there are urgent feedbacks that are there, it's important to take action on them and prioritize them. The next is to embed feedback in reporting. If you have set up a system, you're taking feedback of any kind, make sure that that feedback, your scores, etc., become a key part of your operational reports. When you're looking at how well everything else is doing in the healthcare setup, feedback is also something that should be a part of your operational reports. That's the way your patient voice is reaching your management, your meetings, and so on. So make it a metric that becomes a part of the reports that you analyze. This could be on, weekly or monthly basis, but something that you analyze there. And lastly, you integrate feedback into planning. So there's a lot of planning, obviously, that happens day in and day out at healthcare organizations. There are new initiatives, you look at improving services, renewing services, etc. So when you make feedback a part of your operational reports and embed them in reporting, they also now start becoming a part of your planning. So everything now that you're doing in your healthcare initiatives and in your services will now also have a focus of patient feedback that, oh, this is what the patients did not like. Can we make these changes in the organization to make sure the satisfaction increases as well? So include these insights into your management reviews and planning sessions for sure. That is how you can use feedback for continuous improvement and leverage it for ongoing excellence in the healthcare organization. Now, lastly, something that we basically started with is how do you've set up your feedback, you've set up your CAPA. Now, how do you use this for compliance? So how do you ensure alignment with the NABH and the regulatory standards? So 5 easy steps. 1, organize your feedback effectively. We've spoken about this when we spoke about CAPA again. that have a system, a centralized system where you have all your feedbacks listed. You're able to get visibility of your feedback. The next is to document the improvement processes. Again, something that we're doing in CAPA, that you have a detailed record of all the actions that were taken, preventive measures, corrective actions, etc. All of them are also documented, and any improvements that you're doing based on feedback are also documented very well. The third is to conduct regular audits. Regular trainings. Don't just set up a system and then let it be. Train your team. A lot of team members keep changing. Their responsibility keeps changing. So make sure there is regular training that's happening. You could tie up with an organization that helps you do it, or you could do that internally, where you tell them about importance of feedback, the compliance requirement it has. The fourth is to schedule internal audits. So do checks regularly that everything is working fine. Your systems are working smoothly. Feedback is flowing in. Easy ways to do that is to basically just look the number of feedbacks that are coming in. Are they increasing, or are they in good ratio based on the kind of patients that are coming in? So do your internal audits for sure. And lastly, document and showcase your improvements. So present your feedback driven changes and measurable outcomes for your NABH audits. Whatever changes you've made in the organization, anything measurable, it could be metrics, it could be new processes that you've brought in, make sure that they are also documented very well. Once you have all this ready, you will be ready for compliance as well. And do this very, very effectively so that everything is aligned and according to the regulatory standards. Fantastic. So we've got a question also on chat that talks about how AI can help prioritize complaints. So how AI helps prioritize complaints essentially is that AI helps you recognize specifically in Zonka feedback, AI helps you recognize the urgency of the feedback. So based on the open-ended, and this urgency can be both ways. One, it could be based on how pissed off the patient is, how miffed they are, how angry they are. The second could be actual urgency of that particular issue that's happening. So AI essentially helps you prioritize feedback by identifying how urgent it is. Is it low, medium, or high urgency? And also the emotion. Are they pissed off? Are they just seeking information, etc.? So when you get that information, you're essentially then able to prioritize which complaints need to look at. Great. So before we dive in to more questions, I want to just give you a quick 5-minute overview of how Zonka feedback can help you achieve it. We have looked at certain slides before of how Zonka works, but I just want to give you a 5-minute introduction to it as well. So Zonka feedback, as I introduced in the beginning, is an AI-driven feedback platform for patients. And what we essentially help organizations do is listen to patient feedback. This is through multi-channel, multi-platform setup to act on feedback. So you can set up your CAPA measures like we discussed, and then ultimately have your reporting so that you can improve on, your organization or the operations that you're doing. And how we do this is based on three major aspects. One, integration. So it integrates very, very well with your HIMS systems and other tools that you're using. We leverage AI a lot to give you insights into the kind of feedback that's coming in, how urgent it is, what is the emotion. We're also doing amazing things with themes and sub-themes now that are going to be released very soon. And we also have a workflow designer that helps you automate everything. So the idea is that you use the human to listen, act, and improve, and use the technology through AI workflows and automation to have delighted patients. With Zonka Feedback, you can ask any questions that you like. Bring in your locations, bring in your team members, bring in your doctors so that you can look at what they are being rated like, and also look at very, very in-depth reports, all within the platform. Right? You can set up your triggers so that actions can be automated, tasks can be created, there's communication happening with your patients as well. So everything is already within the platform, and it just makes it easier for your team to implement your feedback and CAPA mechanisms. Great. Now, before we close and before we jump into the questions, I have two very, very interesting takeaways from this webinar. One, when we share the recording of the webinar with you, we're going to share a feedback program setup worksheet. As you saw this webinar, we wanted to make it more actionable with objectives and actions. So that's the idea behind the worksheet as well. The worksheet will give you certain questions you can answer. And when you come towards the end of the worksheet, you will have something actionable that you can set up. And secondly, we want to give you a 30-minute free consultation session. So you will see a link in the webinar recording that we share where you can sign up for a 30-minute free consultation session. There's no strings attached to it. We'll just like to understand what your goals are, what you have currently set up, and just give you some expert advice. We've helped a lot of organizations set up their feedback systems, streamline their feedback systems. So if there's any advice that we can give you with that regard, we'd be happy to do that. Great. So let's hear some questions. Just drop in your questions in the chat, and I'd be happy to answer them. These could be about CAPA measures, feedback systems, what the NABH requires. Just drop in your questions in the chat, and we'll be here for another 5 to 10 minutes to answer those questions. So I have a question here which says, how can we ensure feedback data is unbiased and truly reflects patient sentiment? I think this is very, very easy when you do it with a tool, or if you have some kind of automation setup. Make sure that you're asking patients the feedback right away, or in a stipulated time. For example, after they've been discharged, you may not want to send it right away, but maybe the next day and so on. So make sure you're taking feedback effectively from your patients at the right touch points. And your questions are also unbiased. Your questions should not be leading questions. So don't ask how much did you like, or how effective was the doctor's session. Don't make them leading questions. If you don't make them leading questions, you are likely to get more unbiased responses. Okay, we've got another question which talks about steps that we can take to resolve complaints faster. I think one very important step that you need to take for complaints is to have a team set up. Or at least have one responsible person who's looking at complaints. And this could be one person from different departments, one person overall, but have somebody accountable that, okay, this is where the complaints are going, and this is the person who's going to be responsible. So you can again do this through workflows and automation where you route the right, complaints to the right team members, and then they're able to basically look at those complaints. But yes, from the operational side, of course, you will need to look at how your healthcare organization works. But making the feedback reach the right ears is, I think, the first step to resolving complaints faster. Another interesting question we have is, what's the best way to prioritize changes based on patient feedback? I think what we're doing with regards to themes and sub-themes and using AI would be very, very helpful, because it'll give you insights, and you can do this manually as well right now if you don't have a system set up, is to look at how many complaints have you got, for what kind of issues. Is billing a problem? Is what pissing off people? Or is waiting time a problem? Is there an issue with caregivers? It could also be an issue with just general food, or it could be cleanliness, etc. Right? So you look at what are the themes of feedback that you are getting maximum, and then prioritize it. So if majority of your patients are angry or dissatisfied because of certain themes of feedback, then those are themes that you can resolve first. And then, of course, that's one way to prioritize the changes. Fantastic. Those are some really, really interesting questions. So thank you so much for sharing it. Anything else, any feedback, any comments if you'd like to drop on the chat? Fantastic. Looks like not. So let's close the session. Thank you again for joining in. I really hope that it was a valuable session. Like we promised, we're going to drop in the email with the recording of the webinar, and also share the worksheet with you, so that that's something that's helpful. If you have any questions or you'd like to get in touch with us, you know where to find us. Just sign up for a demo or a chat on the website, and we'll be happy to connect with you. Thank you again. again for joining in. Have a great lunch and have a great rest of the day. Thank you.